Hello, everyone, and welcome to our Monday Minute. Today, as promised, we're going to discuss the 1135 waivers that will come to an end with the end of the public health emergency and some that will be extended. With hospice, as with home health, they will continue to pay for the administration of the COVID-19 vaccine and some of the antibodies. The telehealth situation is much different for hospice than it is for home health, in the sense that with telehealth services, as far as providing routine home care via telehealth, will end with the public health emergency. While the hospices will be able to continue face-to-face encounters via telehealth, they will not be allowed to continue to provide routine home care visits via the telehealth mode. Also keep in mind, as we stated on the last minute, all telehealth services that do continue must be done via a HIPAA compliant telehealth system. During the public health emergency, we have been allowed to use non-HIPAA compliant telehealth means such as Skype, Zoom, etc. There is a list that can be found on the CMS website of the acceptable technologies. So effective May 12th, even the face-to-face encounters cannot be done via a non-HIPAA compliant telehealth system. You're going to want to be able to make sure you can document in your documentation in the chart in the medical record that is in compliance. Keeping in mind that all face-to-face encounters now and after the public health emergency ends that are done via telehealth must be both audio and video, and that must be documented in the record that it was both. The telehealth for face-to-face encounters has been extended through December 31st of 2024. But again, routine home care cannot be done via telehealth after May 11th. Some of the other things that will be ending for telehealth, for hospice, includes the waivers that have been granted for your hospice aides, including the annual on-site in-person visit and the education that you're required to provide for your aides annually. Both of the waivers for you not to be required to do those during the public health emergency will end on May 11th. The QAPI program has been restricted of sorts, not required to be restricted, but has allowed you to focus solely on infection control, or primarily, I should say, on infection control. After the end of the public health emergency, you'll be required to go back to the full-blown content of your QAPI program. One other key element that impacts hospices as a result of the end of the public health emergency is volunteer services. Under the 1135 waivers, the 5% requirement for volunteers in hospice has been waived, but that will end on May 11th, and hospices will have to become compliant with the 5% requirement for volunteers. There is a 10-page fact sheet for the items that will be ending or adjusted with the public health emergency ending that we will provide a link to in this Monday Minute. We hope that this has been extremely helpful. Preparation for the end of the public health emergency should begin immediately. A couple of weeks ago, the National Association for Home Care and Hospice conducted a webinar that reviewed these facts and some of the things that they are still working with CMS on for additional clarification. You'll want to get access to that webinar and make sure you are fully up to date on what you're going to have to change by the time we get to May 12th. Thank you again for joining us today. I hope you have a fabulous week, and if there's ever anything HPS can do for you, don't hesitate to let us know. Have a great day.